We're going to get started. Want to welcome you all on behalf of the German Shepherd Dog Club of America. It's really a privilege to have a club that supports education for all of its members on a variety of topics. Vicki Beaumont. It's been my honor to be the education chair for the past couple of years. We're getting ready to welcome Dr. Gregory Burns, who's going to talk to us about canine reproduction, the management of breeding pairs, and I would like to offer him a warm welcome.
Thanks for having me, and we'll start here with some contact info. That first email, this is an older email, so don't use that. This one is good. I teach part-time at the University of Colorado State. I'm a theriogenologist, so I'm a specialist in animal reproduction, but I only see dogs currently. So this email, if you have any questions or anything pertinent to this or other questions, I like talking about reproduction. So email me, please. We'll have anytime. This is my current clinic. I'm mobile right now. I had a practice for almost 20 years. And I've only, since I got out of vet school almost 25 years ago, I've only practiced reproduction since I got out of vet school. So I was fortunate to start from day one until now, just in canine reproduction. So this is a current phone number. That's the office number. I'm obviously mobile, so I'm not in the office all the time, but I do take messages there. So contact me anytime with any questions, please. Email is best. Okay. Here's that. And again, not that first one. I forgot to take that off. So not that first. Okay. Okay, so this talk is it's wide ranging. I'm focusing on the female right now. It's a pretty broad subject, right? And so this is breeding management from very start all the way through breeding. And so we'll have a Q&A after. This talk is probably close to an hour. If you have a question, burning question as we're going along, feel free to ask. Pretty informal. I typically am when I give these lectures, or if you want to wait until afterwards, that's fine too. And too, if someone has a specific question about a case afterwards, we can talk about that too. I'll also give you my 2 cents on that. Okay, so when I start this, the process, especially if it's a client that I don't know or a new client, I talk about histories first, right? I want to know if she's been bred before, and I want to know about health certifications. This is a big part of my business now as well, is health certifications for all breeds. I focused pretty much on that with the breeding piece. I picked this breed, one, because my sister has one, and two, look at all the certifications that these guys have. I don't know if you guys are familiar with this breed or not, but they have a lot of certifications, a crazy amount of certifications. So I like to use this one as an example. Different groups that I talk about have different questions about certifications, and this one has the most that I know about in different breeds. So you guys are pretty straightforward and have been for a while. Yeah, a few new ones, a few up and coming ones. But I want to know about general health status, vaccine status. I do a lot of titers now as well, but I want to know about vaccine status of the bitch. I want to know parasite control program, and then any current medications or supplements. And supplements are included when I ask those questions to my clients about what they're on, because we want the best possible outcome for the breeding. And then I want to talk about signalment. So is she going to whelp naturally, or is she going to have a problem whelping? Your breed in particular, you guys are probably about in the middle, right? So typically they breed pretty well, and they deliver pretty well. Dystocia happens, but when I think about German Shepherds, I don't think about it as much as other breeds. Flat-faced dogs, right? Terrible bad. Pugs. Yeah. And so I want to know if they whelp naturally. I want to know if they have any predispositions. Toy breeds, for example, can have problems with eclampsia. So different breed predispositions. And then I want to have certain expectations. Age is a big one. I don't have a slide on that. So there are some research papers out, especially with female dogs, and how they change reproductively. Certain size, certain breeds by the time they're 6 or 7 years old. So conception rates go down, litter sizes change. They still cycle, but the expectations have to change as they get older. And yet your breeds, it's kind of tricky because if you think about say a greyhound, they can breed and be very fertile later in life compared to other breeds. So it's not all based on size, okay? But you have to have the expectations. This is what we do when I first see them. I do a general physical exam. Most of my clients have regular docs they go to, regular veterinarians, just because I don't do routine things. I do some routine things, but the regular vet's responsible for their general health piece, and then I focus on this part. One thing I do want to know, do they have normal anatomy, right? And so at their vestibulovaginal junction, they can have things like septums and strictures and things like that. Can preclude them from breeding naturally and from delivering naturally. So that's just part of my physical exam that I do. I talk about general health profiles and general blood profiles, including brucellosis, about every 6 months, right? There's an outbreak in the Midwest of brucellosis. I don't know if anybody here knows about that, but there was and is still current. So we do brucellosis about every 6 months on individuals, whether they're currently breeding or not. I just like to keep them negative on file for brucellosis. Regional diseases, if you live in Arizona, you know about valley fever. Lyme disease is in certain areas of the country. I want to know about those. And then I do a fecal exam as well. Here in Colorado, we have a lot of Giardia. It's pretty common. That's a big thing here. And so I want to know if they're positive for that. We discussed diet. This is controversial, right? Grain-free, the whole grain-free thing. Anybody? We're not doing that much anymore. And that's recent, right? Within the last 6 months, that's how fast that can change. So the grain-free issue, as far as heart problems, we're talking about that and maybe switching over to not being on grain-free. And I know about that personally because I have my dogs on grain-free. And this heart thing kind of came out of the blue. So it is controversial. I try to make it not too complicated. This is about what I want with my breeding bitches. 30-20, right? So that's roughly omega-3 and omega-6 fatty acids, a good mix. Okay. If they're not on the appropriate protein content, that's a really important thing. Then we transition them. As far as amount, we increase caloric intake about 2 weeks. 2 weeks. Increasing caloric intake about 5 weeks post-breeding to a maximum 2 weeks after they deliver. They need most of the calories. Let me have a slide on it. They need most of the calories when they're nursing, not necessarily when they're pregnant. Okay, so about 2 times the caloric intake once they're nursing. That's a rough estimate. If they're really chubby to start with, then maybe not so much. So then we discuss a plan, type of breeding, and you know, this has changed over the years. So because we have a new way that the 20-year-old way was new 20 years ago. Natural breeding, is that preferred method still? Natural breeding?
Oh boy, yes.
Yeah, depends on situation.
It's rare.
It's rare, right?
Well, yeah, finding stud dogs, yeah.
Yeah, in different locations, right?
And getting bitches there, shipping them is.
Yeah, we don't like
can't
doing
ship.
that anymore, that's right. If they're in the same vicinity though, I like natural breeding. So,
But you can't get your lab results back generally from the time you start the progesterones and the breeding time.
we'll
So,
talk
I
about
mean,
that.
you send your samples out and stuff, and they just don't come back fast enough to get a complete reading. And the stud dog owners want to stay safe, so AIs.
Yeah, AIs, yeah. And we can talk about that too. Dogs are unique, right, compared to other species. They have a 72-hour at least fertility window, which is pretty long. And we're warned about 48 hours in advance when that's going to start. So dogs are different than other species. So we have some leeway as far as progesterone testing, but we'll talk about that. I have that here. Okay, AI. So artificial insemination, not an implant, right? So we don't talk about that anymore because implant to theriogenologists means something else. Because we implant things in dogs to make their cycles do things. So the old term that everybody, and still say is, we need to do an implant. And so when I hear that, I go, oh, do they want me to induce estrus in their bitch? Or do they want me to breathe the bitch? Or what do they want me to do? So artificial insemination, not an implant anymore. These are the three kinds of semen we deal with: fresh, breast chilled, and frozen. That's pretty, it's been that way for a long time now, since the probably 80s, mid-80s. It's been pretty common to freeze semen in dogs. A little bit before that with some methods. This is the part we're talking about, travel with the bitch. Shipment of the samples is much easier than sending a bitch. Or a stud dog too. You know, stress is hard on reproductive parts. So cortisol, right? When they increase cortisol, reproduction changes. So it's nice to ship the sample instead of the individuals if they're not in the same part of the country. Okay? This is what we can control: who we're breeding and how we're going to inseminate. These are the types: artificial insemination. There's natural breeding. There's artificial insemination. Vaginal deposition. It's just a vaginal AI. And when I first started doing it, that was our choice, pretty much. And then this thing called TCI came around, transcervical insemination, first described in '93. Doesn't seem like that long ago, really, but it was '93 when they first described that. So we can put it in the uterus also. We can either do TCI, transcervical insemination, or surgical insemination. I probably haven't done a surgery in 2+ years, maybe almost 3 years of surgical insemination. We just don't do many surgeries anymore. I think we're about one of the only countries that we're doing surgery for anymore. Yeah.
What about for frozen? That has to be surgery.
Oh, we'll talk about that. Yeah, good question. Okay. Timing. Everybody's heard this before in this room, right? About timing. It's really important because now we know about the timing. We know about their cycle and what the hormones are doing at certain times and when they're most fertile. So we'll talk about that too. Okay. Ovulation timing. Why is it important? One of the most important causes of failure to become pregnant. If we timed them appropriately, we've checked that box off. If they didn't become pregnant and we timed them appropriately and we documented their ovulation, that box is checked off. That's not why they didn't become pregnant. Okay? So very specifically, we'll talk about hormones. And some of this will be a little bit complicated, and I'm going to go through it kind of quickly. And I know some of you will have seen this a million times and have it down like crazy. But for some people, it might be new. But we'll talk about it, and then we'll talk about questions afterwards. This LH peak, right? Luteinizing hormone. That's basically a peak, and I'll show a graph on this, that's going to tell the ovaries when to ovulate. Okay? If we know this LH peak, we can figure out, it's a good method for determining due dates. So ovulation timing, not breeding, ovulation timing is really how you can figure out when they're due. Because from any single breeding day, that's your due date range. And I've seen 57 days, and I've seen 72 days from one breeding. It doesn't mean they gestated that long. It means that the semen lived a certain amount of time, and the egg lived a certain amount of time, and it was still 63 days gestation. But from a breeding date, and I have a graph that shows this, it can be this long. So you cannot tell due dates from breeding dates. Okay? Only from ovulation time. Another reason it's important, artificial insemination, we're using weakened samples, like frozen samples, because now we're shipping samples instead of individuals, right? So they can be chilled and they can be frozen. When they're weakened, they don't last as long. A natural breeding, that sperm sample inside the female, 9 to 11 days it can last. That's a long time. She can only become pregnant 3 or 4 of those days, but 9 to 11 days, that sample will last inside the female. So that's a long time. So if we're dealing with attenuated samples, chilled samples maybe 4 days, frozen samples maybe 12 hours is how long they last. They don't last days. Chilled frozen samples don't. Chilled samples, 3 or 4 days. Fresh samples, 9 to 11 days. It's a long time. So this is why ovulation timing is important, because if we're gonna use a frozen sample, we have to know those eggs are ready on that day, okay? We'll talk more about that. Here we go, fresh samples 9 to 11 days, chilled samples 3 or 4 days, 12 to 24 hours. I usually err on a 12-hour. I know, I've seen samples of 24 frozen, thawed samples, but we're talking most of the time about 12 hours. That's a busy graph. So this is a really, really good graph, though. This was, it's been around a while, this graph. So there's a couple things I wanted to point out, and this is important. This is estrogen, and this is unlike any other species that we know about. Dogs are. If you'll notice, when they're most receptive, which is here, this represents when they will stand to be bred. Okay, so they'll kind of stand. Some of them will stand -7 days from LH peak. I'll talk more about that in a second. And they'll really stand a day or two before their fertility window really begins. That's fertile, 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 those 3 days. Okay? The point of that is, if they stand here, and that sample lasts, -7 days is a little extreme. How about -6 days? And they're fertile here, that's 10 days. And we just said the semen sample can live 9 to 11 days. So she could be pregnant, standing 6 days before her LH peak, which is 8 days before she ovulates, and 10 days before she's fertile. Other species don't do that. And so we know this now about dogs. To give you an example, cows, they'll exhibit signs of heat in the morning, and they need to be bred that afternoon or evening. And then they're out within 24 to 36 hours, done. That's cows. So most species are that way. Dogs are not that way. So that's the estrogen piece. The other piece that's important is estrogen is declining, and not quite baseline, but almost baseline when their fertility window actually happens. Estrogen is what makes the boys interested. It's not progesterone. It's estrogen that makes them interested. That's all the external signs of heat. So the scent, the bleeding, the swelling, that's what estrogen does. It acts on those target organs, and that's what the boys are interested in. So it's actually declining. They're still interested, these boys are, but now these girls are really going to stand when their estrogen is not quite baseline, but almost. Very unique. All other species, their estrogen is much higher when they're standing to be bred. Okay, so this is important for our understanding of ovulation timing, due dates, when to breed, all those things. Okay. And just real quick, and I know this is kind of an old thing, I know a lot of people have seen this before. This is representing follicles. This is the LH peak. It goes up and down within 12 to 24 hours, very narrow. 2 days later they ovulate, this immature egg, and then it has to divide again outside of the ovary, very unique again to the canine. So it divides again outside of the ovary before it has the ability to be fertilized. So these are the fertility days. 4 days after the LH peak, very unique. Okay, and then it lasts 3 days. And a little bit on the 4th day. I don't rely on the 4th day much. Okay, so that's the important thing. The other thing is, everyone knows about progesterone now. That's what that arm's pointing to. Progesterone starts to rise, again, unique to the canine, starts to rise before they ovulate. It's very unique to the canine. So we get a rise in progesterone, usually between 1.5 and 2.5 nanograms here, and then it rises and it stays high to what their whole diestrogen, which is 57 days. So they have an elevated progesterone for 57 days. And what other species do is they get an elevated progesterone. Their organs don't see a maternal recognition of pregnancy. It's different for each species. And then their CL, their corpus luteum, lyses, and they cycle again. And depending on the species, 25 to 35 days, depending on the species of animal. Okay? And then they cycle again. Dogs cycle twice a year, roughly, depending on breed. Okay? So that was a lot of information in that slide, but this is what we're basing all of our, the knowledge of the cycle is really what we're basing all of our decisions on. Okay? Okay. So ovulation timing, how do we do that? and you guys are familiar with this stuff now. We're talking about vaginal cytology. Vaginal cytology has been done, it actually was figured out at Colorado State University about 1978. They figured out how the vaginal cytology relates to the stage of the cycle. And so I like vaginal cytology. I still use it. It's relatively inexpensive, not difficult to interpret. I can't figure out exactly the day they're on because it's estrogen that's driving this. Okay, so they're most quantified, and I have pictures of the cells. This is a good slide of the cells. So they're most quantified as their estrogen is peaking. So that's likely a day or two before they're most fertile. Okay, so I don't use this for frozen samples, but I can use it with other types of samples and see, oh, well, she's 100% quantified. She's going to be fertile within 24, 48 hours. Let's go time. Because I know that sample I'm putting in, if it's a fresh or fresh chilled, I've got that coverage. 3, 4 days, or 9 or 11 days. Okay? So these are what the cells look like. You guys have probably either seen these or heard of these cells. Quantified cells. I think I have some better pictures. This is a nice slide because it tells you, it relates what the hormones are doing to what the cells look like. So here is, I don't think this one has estrogen on it. Let's look. So here's an estrus slide. So these are quantified cells. If they don't have a nucleus, like this one, large angulated cells. Has anybody seen these? Some people do it, yeah. Some people do it in their own house or their own practice, and a lot of my breeders are good at it. They can tell me. It's nice to do because then they can save money on progesterone testing if they follow the slides. And it's not hard, but it does take practice, and you have to get the sample appropriately. You have to get it from the vaginal vault. I have a slide of that as well. So these are superficial epithelial cells. These cells come from the vaginal vault that when they're not in heat is 2 cell layers thick, and when they're in heat is about 60 to 80 cell layers thick. And all these cells are the cells sloughing off. They're almost like skin cells as it gets thicker. So the cells of the vaginal vault are preparing to be bred, and they'll slough off. Okay? So this is a nice estrus slide, and if you notice, that's a ghost nucleus. So this is a nice big, it's not as angulated as that one, but it's a nice big cell, just a little tiny nucleus going away. That's a pycnotic nucleus, so that will eventually look like that, and then like that. So it's this continuum of cells that slough off, and that's normal process. This is not an estrus slide. This is a diestrus slide. And if you notice, this is a good representation of a cell that's not in heat. That's a parabasal cell. So is that. This is an intermediate cell. And then look, there's one superficial cell with it as well. So if I see a predominant cell type of parabasal cells like all these, I know she's not in heat. Okay? So she's either an anestrus or diestrus. Okay? Here's a summary. This is a, I like this summary. It's got, you have to base your cytologies on the predominant cell type. So for example, if I say, see, this is the kicker here, right? Plus or minus white blood cells. Well, minus white blood cells, because there are normally not a lot of those present during estrus, but if I see an estrus slide and I see one here or there, it's okay. If I see a bunch, then something's up, okay? So it's a nice summary of what I'm looking for with vaginal cytology, okay? Okay, vaginoscopy, excuse me. Anybody heard of this? So this is what we've learned to get good at as we've done transcervical inseminations. Okay, we see the vaginal vault at various stages of the estrus cycle. And I had one the other day. I think I'm okay at it. We just started our 20th year doing transcervical insemination. I have, and so I've done this a lot. And I had one the other day. I looked at the vaginal vault. I had a progesterone from someone traveled. She had it from her other doc, was getting worried it was time. And it was close. It was like an LH number. So I said, okay, let's do it. was a fresh collect TCI, so I had both participants. The sample was not in short supply, so I said, let's do it. So I looked at her. I said, she looks maybe a day or two early. Let's do a progesterone, and then we'll reconvene based on the progesterone. I got it back, she was 1 day early. And so, just looking at it, I knew that it wasn't just right. So that's what we're doing with vaginoscopy. And you can really narrow this down from a day or two if you do a lot of vaginoscopy. When they're in proestrus, it's smooth and shiny and pink red appearance. That's what it looks like. That's not a great image, but that's the image I could get. Okay. Now look how different this is. So that's what they look like in proestrus. That's in estrus. Right? These are extreme slides. It's really not that easy, but it can be if you do it a lot. So this is an estrus slide. And if you'll notice, it goes from pillowy and kind of shiny and not as, look at these folds that have started. And so that's an estrus type of vaginoscopy. And then diestrus is mucousy, that everything's changing as far as clean after the breeding process, and once the cervix is open, certain immune processes start, uterus, cervix, vaginal bulb, that create mucus and clean everything out. And that's when you get your white blood cells, which can be normal in this stage, but vaginoscopy looks a lot different. A lot of this is just mucus. And then it goes back to that pillowy, less folded part. So that's just a basic overview of what we're looking at with vaginoscopy in order to determine what stage of cycle. Okay? Okay, LH peak. Very narrow in the canine, 12 to 24 hours, that's it. So if we really wanted to check LH peak and be really good at it, we'd have to draw blood every day. We don't like drawing blood every day. I had one that I just bred, by about the 6th time, she didn't want to come in the door anymore. And I only see healthy patients pretty much, and she wasn't happy to see me. My patients are usually really happy to see me, except in those situations. So LH peak is tough sometimes because you have to draw blood. You do have to get it every day. Fertilization period, so they're fertile about 96 hours after the LH peak. That's when it starts. Okay, 4 days.
4 days.
2 days later they ovulate. 2 days later their egg's ready after the LH peak. Okay? Here's the test that we do. Has anybody seen that before? Worked in a doc's office or anything? So it doesn't look very complicated, huh? It's not. And so I'll tell you what I like about it and what I don't. Here's the instructions. It's really simple. 3 drops of serum there. It sweeps across. Wait 20 minutes. Read the test. Simple. The hard part's here, interpreting the test. So this test came out in the 90s. Our hospital was one of the first hospitals to get it, and we started using it. It was thrilling to get it, to be honest, because it was going to really help us time these girls for frozen. That was our big thing. We want to know exactly when she's due, or when we can breathe. So the test came out. It was going great, and we had the great idea to test the bitch once we got a positive the next day. And we tested her the next day and got a positive. And then, so we did that several times, and we would get positives 2 days in a row. So then I thought, well, let's check her on days when we don't think she's having an LH peak. Like the day before her suspected LH peak, right? Because we get ideas on their LH peak based on progesterone. So we would check them that day, and some of them came out positive. So we were getting them positive, positive, positive 3 days in a row. So we started making these reports. The company took it off the market, and it was probably, I want to say about a year it was off the market. Not available anymore. So they're going to fix the test. Came back on the market with different directions. Same test, but different directions. And the new directions said you have to interpret the intensity of the line. The original direction said if there is a line present, it is positive relative to the test, to the control line. The new directions had me looking at this line and deciding if it's darker, not as equally dark, or not as dark as the control line. And so that was that made it a really subjective test, because I would then do the test, and then I would ask 3 or 4 different people and get different answers. Well, I think it's darker. And the other person would say, well, I think it's the same. So the test is, the point is, it's somewhat of a subjective test, okay, for LH. And this is what we have right now. It doesn't mean I don't use it. I do still use it. I just don't rely, I rely on it with my other methods of population timing. Okay, that's the point. Okay. Okay, so that leads us to progesterone testing. We've been doing this a long time in dogs, and I think we're getting better and better at interpreting what means what. It's changed again in the last 5 years or so, how we interpret progesterone levels. Okay. So there's 2 types of tests. There's qualitative testing, which is an approximate. This is a chemistry definition of what a qualitative test is. So it's kind of like this one. That's a qualitative test. It doesn't give me an exact number. Okay, that's a qualitative test. And then we have quantitative tests. That gives me an absolute abundance of the substance, of the progesterone. So I get a number. That's basically the easiest definition. So this gives me a range. This one gives me a number. Okay. So there's lots of ways to do progesterone testing qualitatively. And you guys have probably seen all these. A lot of these have been around a long time. I know that this one, well, both these. These are the 2 that I know. Yeah, so these guys have been around a long time. This one has the wells. Again, a control well, 2 control wells, and a test well. And what you're doing is interpreting the intensity of the color change compared to the controls. Okay. This one has dots on it. Same idea as this one, and except it's in dots. And again, it's a range. So it'll say between 0 and 3, between 3 and 10, greater than 10. So that's an idea of what these progesterone tests will give you, qualitative tests. These are quantitative tests, okay? This is an Emulite machine. I think that one is as well. That's a TOSA machine. That's a mini Vitus machine. So these are all laboratory machines. These are the kind that, these guys are ones that IDEX or Antec might use. This one is an in-hospital machine that repro guys have, practitioners have, TOSA and mini Vitus machines. The important point on these, especially mini Vitus and TOSA machines, is that progesterone is the same hormone structure whether it's a horse or a cow or a dog. However, or human, and however, this machine will interpret a dog sample differently than it will interpret a human sample or a horse sample because of the way that the proteins bind the hormone in dogs versus horses versus humans. So you can't just take a sample from a dog and run it over to the human hospital and get an accurate number for a dog. And I learned that the hard way 20 years ago. Unless they have their machine calibrated for a dog. Okay? So mini Vitus machines are the same way. This is a human analyzer, but you can easily calibrate that for dogs. I say easily. It takes about, we did 2,000 samples. I guess that's a lot of samples. And we made a curve, and then we calibrated our machine to dogs. And so it's easy to do that. I say easy. Kind of a lot of work, but it's not technically demanding to do that. Okay? So that's an important point for progesterone. Antec and IDEX, their machines are calibrated appropriately for the species they're looking at. Okay? So that's an important point for quantitative testing. Most accurate right now, I think, when performed by reference labs. Canine ovulation, I think around 4 or 5. It could be as high as 9 or 10 on the curve. So they could ovulate when they're 7. You know, the old thing we used to do is wait until they were 5, count 2 days, and they're ready to go. And we would stop testing them around 5 nanograms. And that was a mistake. I'll show you why in a sec. LH peak occurs when the progesterone level is between about 1.5 and 2.5. Dogs get high in their progesterone levels, 20 to 30 or higher is not uncommon. Other species don't get that high progesterone. So their CLs producing the progesterone produce a lot of progesterone relative to their size. Again, fertilization period begins 48 hours after they ovulate because they ovulate that immature egg. Okay? It takes 48 hours for the egg to divide again outside of the ovary to become fertile. Okay? This was reprinted. This research is probably 15 plus years old. This was reprinted. The reason I put this slide in is that IDEX is now using this. And I saw it, I've been using IDEX for 25 years. And I've seen different things on their progesterone results as far as interpretation. So this is a newer interpretation in the last 2 or 3 years that they came out with, more detailed. And I thought I remembered seeing this. It's old, and now it's come back. So this is a nice, I give this to the young veterinarians who are wanting to learn more about reproduction and who are wanting to understand hormones a little bit more. I just started giving them this slide and interpreting the progesterone because it's not one particular number that we're looking for. Really what we want is this. Because there's individual and breed variation, look, ovulation between 5 and 12. Well, that's not very helpful. So, because there's breed and individual variation, we want a 2 times rise of their progesterone level in a 24-hour period. That confirms ovulation. This is the new thing in the last 5 years, okay, or so. It makes perfect sense. And we can talk more about that. That's an ovary. That's a CL. That's what's producing the progesterone. This is a follicle that's developing. That's a big follicle that's getting ready to ovulate. That's a follicle that's kicking out the ovum. And these cells that are lining this follicle turn into these progesterone-producing cells. That's where the progesterone comes from. So what we're looking for is a little bit of progesterone, a little bit more, and then a lot. That's the most basic way I can explain that. Once we get that lot, 2 times rise, so if they go from 6 to 12 in a 24-hour period, I know that this has happened. All of these cells have turned into these corpus luteum cells, and they're producing progesterone. Okay? So that's why we're looking for that 2 times rise, to confirm our ovulation. Because again, that's not helpful. If I get a 6, and then I breed 2 days later, or 3 days later with frozen, and then I do a progesterone and she's 9, which happens, that was a bad deal. I'm probably not going to get her pregnant. So anyway, a little more exquisite ovulation timing using progesterone if possible is the point. Okay. So once we time them, we can talk about methods of breeding. Natural breeding, we talked about that. Not always possible. Breed differences as well. I had some corgis the other day that couldn't breed naturally. One was taller than the other. Corgis are kind of, you know. So the girl had just long enough legs, the boy couldn't do his thing. So we ended up, and I said to give it a go. Because if the participant, if they're in the same area, breeding naturally is still, I think, I like that. If you have a boy that's young and can get the job done, and you know he has a good sample, breed natural. So anyway, but sometimes it doesn't happen. So. Natural, right?
They do?
Well, she was going to say like put the girl on or put the boy on a ramp or something.
Right, yeah.
I think it was too much work for her, so they're just like, God, just do it. So, but there are ways. Okay. Okay. Ovulation timing. Why would we ovulation time if we're breeding naturally, right? So this is why. We want to know when she's truly fertile, so maybe they're in the same area, but one person is across town. It's nice to know, okay, come on Tuesday and or Monday and Wednesday, and then we're done. Okay? So that's a good reason to be more efficient. If they're both in the same house, that's one thing, but that's not as common anymore. We can get an accurate due date if we do ovulation timing again, because remember that really wide due date based on breeding. It's just not accurate. Okay? So we can get an accurate due date. If they don't take, so if they breed naturally and they don't take, I'll have numbers so I know that she ovulated. Okay? So that's a good thing. If she was having troubles and maybe she didn't get pregnant the first time, maybe do something different the next time. Okay? All right, fewer naturals, talked about that. Again, here's how sperm longevity, motile sperm recovered from a bitch after 11 days from one breeding. It's a long time. Okay? So the point of that is for natural breeding, we have room for error on the day that we breed. Even if you gave it 5 days, you have 5 days to be wrong on your timing and she'll still get pregnant. Okay? That's for natural breeding. Went through that a little bit. This is what most people do, and again, people have a lot more experience with natural breeding than I do for sure. But this is what I hear is most common. Breed every other day during her receptive period. Some people will do that, not necessarily daily. I think that's maybe overdoing it a little bit. But every other day, if they're in the same house, until she won't accept the male anymore, and then you're done. I think that's a good strategy. If we know exactly when she ovulated, breed 2 and 4 days after ovulation, or so. You can start a little early if you want to, or you can breed once 2 days after ovulation. Okay, so those are just some things that I hear that a lot of people do, make it a little more efficient. And then there's AI, so artificial insemination. Timing is important, we talked about that. We're usually using attenuated or weakened samples. We usually do this during their fertile period. So the day that we're doing it depends on what type of sample we're using, because that will tell us how long the sample's going to live inside the female, roughly. And those are the 3 choices that we talked about before. Vaginal deposition, that's a vaginal AI, that's a pipette. There's new ones out now that we use that have ports on the side instead of the end and a little more flexible, so there's different ways to do that. Not recommended for frozen samples. Frozen samples just, I hear they get pregnant sometimes, but I probably would never use a frozen sample vaginally. Most of the time frozen samples are in limited supply.
Yeah.
So we want to be perfect with where we put it at the time we put it. This is just introducing the sample into the vaginal ball using the pipette. And I don't have a slide of that, but it's most often the 1st and 3rd day of a fertility window. Okay, so we talked about that. That would be this day, this 4. Again, that's relative to the LHP. 1st fertile day, 3rd fertile day. Again, she has a little time the next day to be fertile as well. And after you do vaginal insemination, it doesn't take long for the sample to get where it needs to go, right? I do like them to be quiet for a bit. I don't elevate them as commonly as I used to. With vaginal, I still do it. A paper came out not long ago saying you don't have to elevate them. Same pregnancy rates, same litter sizes if they just stand on the ground. So I still do that, just because I've been doing it 20 years that way. So with vaginal insemination, I still elevate. Okay, but not. A lot of people don't do that anymore. This is what we used to collect. Those are polypropylene. Just a couple things with this. These used to be rubber. We used to use rubber ones. We don't use rubber anymore. That's touching semen samples. Weakens the samples. And not that big of a deal. If I have a fresh boy that's producing tons of sperm cells, I probably don't worry about it too much. But we get a lot of weakened samples as well. And for example, if I have a 60-pound dog and I get 200 million, which is not a good sample for a 60-pound dog, I want all of the 200 million. So, 20% of them, because I use rubber, aren't any good, I don't think I've done a good job. So I just make a habit of using polypropylene, everything. Those tubes are polypropylene, and there's different methods and different things to use, but this is one. Some of these come with a closed end, so you can just collect in there and not have the tube. So there's different ways to do it. Different syringes. This one doesn't have rubber in it, so again, if I'm using a frozen, so I'm kind of picky about it. If I have a frozen sample in here for 10 minutes, it's probably not going to do anything with the rubber. If it's longer, I'm not really going to like it being in there too long. That syringe doesn't have any rubber. Those are AI pipettes. Those are the older ones that we used to use. I still have some of these, and I think they work fine. The end is on the end is open. It's a little tougher because if you get up against the tissue and then squirt it, it can reflex back a little bit. So they make these now with ports on the side, which I think are a little nicer. So those are AI pipettes. And then transcervical insemination, we've been just starting our 20th year doing transcervical inseminations. We use all kinds of samples with this, fresh, chilled, and frozen. This is a rigid endoscope. We look at the cervix, we pass a catheter through the cervix, into the uterus, deposit the sample. It's not actually that easy. But it's getting better over the years. Okay, so here's when we do it. First and third day with fresh and fresh chilled. So same as fresh vaginal AIs. Second fertile day if I'm using frozen. Okay, so that would be this day. That's why it's circled in red. That's considered her most fertile day. Okay? 5 days after her LH peak, 3 days after she ovulates. That's when she's supposedly most fertile. Sounds like I know a lot about this, but sometimes they don't get pregnant, right? So there's a lot more to this, the pregnancy piece. But the reason I'm so picky about this part, again, we only control who we're breeding, where we put it, and when we put it. And that's it. The other 57 steps to become pregnant are out of our hands. Okay? So I'm kind of picky about when we're inseminating and the method we're using. Okay? Okay. So that's TCI. I put these. That's our original scope. This is actually identical to the original scope that it was first described in '93 by Marion Wilson. She's a Scottish lady, but she lived in New Zealand, and she wrote that up originally in dogs in '93. This was my first scope as well. She had the same one, so I just got the same one she had. It wasn't quite that long ago, but almost. So that's a bigger port. So you can notice there's a lot going on here, right? These are working ports, working channels. That'll accept an 8 French catheter. I have a picture of that. This is the eyepiece where the camera goes, or your eyeball. When she first started doing it, she put her eye up there. That was really hard because the dog's moving around and stuff's going on, right? You're trying to look inside this little scope. So I used this for about 15 years. Or so. This is the new scope. This is made by Stores. And I knew this was out for a while before I got it. But it's hard to change, when you're using this for so long successfully. So finally I ordered the new scope. They're really expensive. So I ordered the new one because this one got closed in the door and broke by one of my technicians. And once this breaks, so the optics are really nice on these because they're glass inside. The glass doesn't come out when they break, but when they break, you can hear the glass back and forth inside. But the point of that is the optics are unbelievably clear and nice with these old scopes. Just a beautiful picture we would get. This scope has a fiber optic setup. It's not like a flexible fiber optic scope. It's semi-rigid, they call it, so you can do this to it just a little bit. But the image is not as nice as this scope. But now the new people doing TCIs will never see this scope, so they think that's the best. But the image was really nice on this. So I use this one now. You'll notice it's longer and thinner. And so this was really hard to get longer bitches. German Shepherds they were still pretty good with this. Mostly mastiffs, borzoi, some greyhounds, some interesting breeds where we really have to push it in there as far as we could. This scope gets all breeds. I haven't found one that, and in fact, the little guys, it's only this far in, and the big guys, it's maybe this far in. I haven't, none of them that far. So even the really big ones. Okay. So that's a newer scope. Oh, here's old equipment. So that's what I used to use. So that's a Sony monitor, and that's a light source. That's a xenon light source. That's a halogen light source. That's the camera. And that one of the one of the students that I have. Oh, that looks like a VCR. I saw one of those.
Oh my God.
And so yeah, it's kind of like that. But so it's a medical tape image thing. So that was nice to have back then. And then there was a newer version of that kept it on this little tiny floppy disk right there. And then this thing is what I use now. That replaced all of that. So that has everything in it. And you get the images with this little stick you put in there, So it's amazing, right? So this is portable too. It's in a little suitcase and can go places. In fact, I said I did only dogs. I have a tiger that we're going to do in 2 weeks at the zoo. And so we're going to use this. It's going to be in a suitcase, and we're going to take that over there. So it's portable, right? So, and it does all the things that these do. Again, the image quality, still better with all that analog stuff. This is LED, it's bomb-proof, it's really nice. So that's a newer equipment. That's an old catheter, that's an 8 French polypropylene catheter. And so 8 French is good, it's big, okay? But that's what I used for 15 years, right? We can use, now I use 4 and 5 French catheters, so half the size as far as diameter of this. That's an older picture, obviously, and but I wanted to show this picture because her vulva is probably about here, not quite here, that's where her thigh is, but her vulva is probably here. And when we bred her, so you have to back this up, I got a bad angle, but if you back this scope up about here, that's where her cervix is. Okay? So her cervix isn't here. They have an abdominal cervix. So that's really important. You kind of have to know what you're doing when you do this procedure, because this scope in this bitch was all the way in. Okay? In her vaginal bulb, looking at her cervix. Okay? So I think that's important to know. Our newer scope, again, is about half the diameter, and it's about that long. So I have lots of area sticking out there. Here's the cervix right here. So the cervix is here. Here's that polypropylene. I have newer images, but apparently I use these. That's that polypropylene, that 8 French polypropylene catheter. And there's her cervical os. That's the opening right there. So that's the catheter in the cervical os. Okay? Cervix is about 3 to 4 centimeters, so about that big, depending on breed. And then, so that's important to know because you have to know how far to put it in, right? The new catheters have marks on them that are black marks that are a centimeter each. So I know exactly how many centimeters I'm through the cervix. And they're half the diameter of that. So it's pretty convenient. The new fangled equipment is pretty nice. Okay. Has everybody seen a TCI? This is kind of a bad image of a TCI, but this is what's happening here. Things are kind of moving around. This is that catheter cannulating it up. That couldn't be any worse. Anyway, all right, good. Everybody got that. So anyway, what happens is we're looking at the cervix, hoping the bitch stands still, and she usually does because we put this thing called a shunt in there that blows up this balloon. That the scope goes through the middle of that. She stands. She thinks she's being bred. She's releasing hormones as if she's being bred. That's what's nice about that shunt. We look at the cervix, cannulate the cervix, sample in her uterus. Okay, that's kind of the gist of it. I know probably everybody's in here has seen it now. So So numbers, we'll talk numbers real quick about TCI. So again, about 20 years I've been doing TCI. In probably the last 5 years to 6 years, we've been doing a lot of frozen TCIs, no surgery. And in fact, the numbers now have come back. Frozen versus transcervical insemination, surgery versus transcervical insemination with frozen samples, and conception rate and litter sizes are slightly higher with transcervical than surgery. So if you get it in the right place at the right time, as good or even better. The old, I'm saying old, mid-2000s research that came out started looking at that, and they were getting the equivalent. They were like, hey, this transcervical, mostly it was the Greyhound guys. Does anybody know the Greyhound guys? So they do, let's see, where are they? Kansas and, they're Midwest, I should say. They do a lot of the research because they have a captive population that they do. It's almost like the working dogs for the military guys. They give us a lot of numbers when things change because they do a lot in a hurry. And so the original stuff came from the Greyhound guys, and that was about 2004, and they were looking at about the same numbers, transcervical versus surgical, conception rates, litter sizes. Those were hard to accept right away because they're Greyhounds, and Greyhounds are super fertile. They could probably throw it on the floor and she would have got pregnant too. So that's how Greyhounds are. So we're thinking about the Greyhound thing, and us, me included, I was like, oh yeah, but that's Greyhounds. I don't know if I'm going to believe it until. So now, retrospectively, they've looked at thousands of dogs, because now it's been, even since that original study, 15 years since the original work. So now we're looking at numbers, and they're as good or even a little better. I don't know, I still don't know if I believe the better yet, but now they're thinking about why would it be a little better, maybe less stress of surgery.
Yeah.
Or maybe we're getting better at TCI as a group, right, as veterinarians, maybe something like that. Maybe the frozen samples are getting better, I know that.
Yeah.
Our post-thaw motilities are better than they were 20 and 25 years ago. Back then, 50% was considered average. I just thought one this morning that was 80% post-thaw. That is really good post-thaw. So a combination of something is helping us get better at this. All right, and then so there's surgery. Again, I haven't done, it's probably been almost 3 years since I've done a surgical insemination. Reserved for special cases, I'm saying very poor samples. I probably get the same, see I haven't converted all the way yet, right? I probably get the same number of, I would probably get the same conception if I did transcervical or surgery, but I still feel compelled just because I've been doing it so long. If I have that one sample left and it's not a great sample, I might do surgery, right? I don't know how long that's going to last though, because we're one of the last countries I think that's going to allow surgical insemination. Yeah.
Do you like to do surgical also if you have a bitch that's not getting bred and you want to check to see if she has like uterine cysts and things like that?
That's a good question, right? So intrauterine cysts. And that's controversial now because you know what we used to do, right? Put them under anesthesia, abdominal incision, expose their uterus, pop all the cysts and breed them. Surgically, right? So now they're saying, well, stop popping those cysts. You're causing inflammation in the uterus by popping all those cysts. So it's changed a little bit over the years. I'd still like to know if they have those intrauterine cysts. I don't know, and they've looked at that now too, surgery versus transcervical insemination, even though you know they have cysts, same conception rates. Yeah, so I don't know. I think again, I've been doing it long enough where I know my next surgical insemination is coming. I just don't know which one. If I want to evaluate her uterus though for any pathology, and cysts might be on the list or other things. She might have cystic endometrial hyperplasia significantly.
Yeah.
She may have an ovary problem that they just can't get on ultrasound, that they just can't see.
Endometriosis.
Yeah, and endometriosis is common mostly in other species. Endometritis in dogs, that inflammation. So similar, but a little different. Horses get endometriosis and humans. Dogs get endometritis, typically. Same, it's not exactly the same, but similar idea. So we can diagnose that with biopsy. But now we can do biopsies transcervically without putting them under and without getting full thickness biopsies with surgery. So we do that with a little biopsy instrument through their cervix, pinch a piece off, send it to the lab. It's a little harder than I just described, but that's kind of the way it works. Yeah.
On thawing frozen semen, are you finding that it makes much difference on the age of the freeze? I mean, like semen frozen 20 years ago versus
New,
stuff, yeah.
right, on thawing it.
Yeah.
So, the question about thawing frozen semen and the age of the frozen semen. It shouldn't make a difference whether it's 35 years old or 2 years old. It should be the same that it says on the paperwork. The oldest I've used is 36-year-old semen. I didn't freeze it, obviously. But I've used it successfully, right? That's an old sample now. I think a lot of that has, and freezing it takes a certain amount of expertise. That same expertise is required for thawing it, because thaw rates and the way you thaw semen is super important. It's as important as freezing it. And I think as veterinarians, sometimes even repro guys, we get kind of nonchalant about it, and I caught myself doing that when I was training. And then I would be like, oh my gosh, why are you doing that? And they're like, that's how you showed me how to do it. And I was like, oh, we don't do it that way. So thawing is really important, and just cutting 1 minute or 1 degree on your water bath can make a difference in the sample. So, but the post-thaw motility should be the same if it's 2 years old or 35 years old. So, as long as it was stored properly, yeah.
We just did a dog that was frozen in '91 at Houston at, I'm sure you know which one I did.
Yep.
And 95% motility.
Yeah.
And 8 puppies.
Yeah. Yeah, crazy. So those samples are out there. And there's certain methods that I like more than other methods. Some of the buffers that we used in the 90s, I think could be improved upon, even some of the ones that I used in the 90s. And there's new methods out there that I think are a little bit better, and new methods coming out too for frozen semen. But some of that stuff is really good even from the 90s, yeah.
How does cyst
Yes.
interfere with pregnancy? And also, how does the size of the cyst
Oh my gosh.
take away from the bitch ovulating?
Those are 2 really good questions. So if they have cysts, technically they have cystic endometrial hyperplasia, right? So that's what those cysts are.
This is ovarian cyst.
These are uterine cysts.
So we're talking about.
Oh, you want ovarian cysts?
Yeah.
Oh, okay. So ovarian cysts in dogs are really 3 varieties, but we'll talk about 2. They're either luteal cysts, right, the kind that continually produce progesterone, or they're follicular cysts, the kind that produce estrogen, and that causes prolonged estrus. Those dogs are a disaster if they have prolonged estrus. And they're a disaster because estrogen coming from that cyst on the ovary is continually bombarding the target organs, specifically the uterus, which is only supposed to see estrogen a couple weeks, right? Or so, and then it's supposed to see progesterone. Well, if it sees estrogen for several weeks or a month or 2, now all of a sudden the glands, the target organ, and the glands inside that target organ, instead of being a certain size and a certain level of fluid production, now all of a sudden it's twice. And so the endometrium can't handle that, right? And so all of the changes that happen on the endometrium that are supposed to be good for pregnancy with estrogen, all of a sudden are bad for pregnancy with estrogen, with too much estrogen. So that's what those cysts do. In dogs, they have this nebulous number of 8 centimeters is considered, 8 millimeters is considered an ovarian cyst. It's a little subjective, right? You could have
How big is that?
8 millimeters is considered a cyst and not a follicle, so less than a centimeter, so this big. So that if the radiologist sees that on an ovary, she'll say, I think that's a cyst, not a follicle. So those estrogen producing cysts are just really tough on dogs.
So what is the shot that you give that helps the bitch release eggs?
Right, yeah. You sound like you may know something about this, right? Unfortunately. So there's a couple different kinds of shots you can use. And so the problem with the shots is that the bitch already isn't responding to the hormone that's supposed to make them go ahead and ovulate, right? And so they're looking at this FSH and LH, and the ovary's ignoring it. The ovary is ignoring the FSH and LH and just making its own fluid and going rogue. I'm oversimplifying it, but that's what the ovary's doing. So what we thought was a great idea was, well, let's, instead of, you can't really just give them FSH and LH, but you can give them hormones that makes them produce their own FSH and LH and release more of it. So the idea is, well, maybe they just need more of it, more FSH and LH to make that follicle respond. And so we give them more. We give them shots of GnRH or HCG, right? HCG is a human hormone that in every other species, if you give it to them, makes them ovulate. Curious enough, right? But I use GnRH, gonadotropin releasing hormone, and what that does is it makes them produce more endogenous FSH and LH. So hopefully their ovary listens. They have to be at a certain level for their ovary to listen, right? And so if they're 0.8 level of progesterone, I'm not hopeful they're going to listen. Let's say they've been 0.8 for 3 weeks. I'm not hopeful their ovary is going to listen. If they're, what's that?
What might it be with?
Yeah.
It's causing this.
Yeah, we don't know. Have no idea. I know some things that do cause it. If you put an ovuplant, I could cause it in a bitch if I wanted to with an ovuplant or some other drugs or medications that I give, hormone related. We don't know. We think it runs in lines though.
Is it more dominant in time and we're seeing more now than you've seen?
I don't think so. No, that's a good question. I don't think I see ovarian cysts more commonly now than I did 10 or 20 years ago. The thing with cysts though, once their progesterone does start to rise and they go through that thing where they rarely get a 2 times rise in 24 hours. They rarely get that. But I might be able to luteinize them by giving them those injections. And that means I got rid of the cyst. I got those cells to infiltrate with luteal cells instead of follicular cells. And now they're producing progesterone. But what their progesterone profile does is it goes 2.5, 3, 3.5, 3.8, 4, 4.9, all the way up until they're 12-ish. And every other day they'll just get that little tiny rise. Once they're over 10, I'm pretty happy that they've luteinized and they've become progesterone producing cells, which is good because the longer they're in heat and then I shut them down and then make them produce progesterone and close their cervix, say they're in heat 4 weeks, 5 weeks, 6 weeks, 7 weeks, they're predisposed now to pyometra because now their endometrium isn't normal. And any bacteria, now their defenses for pyometra that are normal are abnormal because their normal defenses aren't used to dealing with a giant endometrium and a giant cyst or gland or that amount of fluid versus this amount of fluid. So it does predispose them to pyometra having those cysts, unfortunately. So that's a good question with cysts. That's a tough one. That's one of my, it's just a bummer when I see them because I try to give them shots, I try to do these things, there's just no great answer for cysts. Okay. Okay, so that's surgery. Okay.